Have you ever felt a strange tingling in one of your legs, almost like tiny insects crawling under your skin? Or perhaps you've been startled awake by a sudden, sharp cramp in your calf. Maybe by evening your legs feel unusually heavy, as if weighed down by lead. At first, these sensations might seem harmless, just another part of getting older or sitting too long. But in truth, they can be early warning signs that blood clots are forming inside your veins, especially in your legs. Left untreated, these clots can block circulation, cause swelling, and even damage surrounding tissues. In the worst cases, a clot can break loose and travel to the heart or lungs, leading to a life-threatening emergency such as a pulmonary embolism or stroke. The most frightening part? Many people don't realize what's happening until it's too late. But here's the good news. Most cases are preventable. With the right nutrition, specifically 4 key vitamins proven by science, you can help dissolve blood clots naturally and support healthy circulation in your legs. So, which vitamins are they and how do they work? Stay with me because these nutrients could be the key to keeping your legs strong, your steps light, and your body healthy well beyond your 60s without invasive treatments. The importance of circulation as we age. As we move through our 60s, 70s, and beyond, every steady step depends not only on muscle strength, but also on the health of our circulatory system. Blood clots are among the most common risks for older adults, especially after surgery, during long periods of sitting or recovery, or in those managing high blood pressure or diabetes. According to Dr. Helen Farnsworth of the Mayo Clinic, preventing and dissolving clots isn't about a quick fix. It's about consistent lifestyle choices, especially nutrition. She highlights 4 specific vitamins shown in clinical studies to improve blood flow, calm inflammation in the veins, and strengthen the heart and vessels. The best part? These nutrients are easy to find in everyday foods, safe for most seniors, and simple to add to your meals. Before we discuss those vitamins, let's look at 5 warning signs your circulatory system may already be under strain. Think of your blood as a river carrying oxygen and nutrients throughout your body. Under certain conditions, that flow can be disrupted and clots may form where they shouldn't, often deep in the veins of the legs. Clotting is a natural defense against bleeding after injury. But when it happens without cause, such as after long periods of sitting, illness, or inactivity, it becomes dangerous. As blood pools in the calves and flow slows, pressure builds and vessel walls can be damaged. That's when clots begin to form quietly and often without obvious symptoms. Early warning signs might be subtle: mild swelling, a tight calf, or heaviness in one leg. Ignoring them, however, can have serious consequences. If the clot blocks blood flow or breaks free, it can reach the lungs and cause a pulmonary embolism, a medical emergency that can be fatal within minutes. That's why it's so important to recognize these signs early and take them seriously. 5 warning signs of blood clots. 1. Shortness of breath and chest pain. If you often feel breathless after light activity, or if sharp chest pain worsens when you breathe deeply, it may signal a clot that has traveled to the lungs. This condition, known as pulmonary embolism, blocks oxygen from reaching your bloodstream. It can cause dizziness, shallow breathing, and stabbing chest pain that many mistake for a heart attack. If you experience these symptoms, seek emergency care immediately. Early treatment saves lives. 2. Swelling in one leg. Notice one leg, usually the calf or ankle, becoming swollen, warm, or discolored. This could indicate a deep vein thrombosis, DVT. When blood flow is blocked, the leg can feel heavy, tight, or painful, especially after sitting or lying down for long periods. Swelling that affects only one leg, not both, is a key warning sign of a potential clot. Don't ignore it. Prompt medical care can prevent the clot from breaking loose and traveling to the lungs. 3. burning or itching sensation. A persistent burning or crawling feeling inside your leg without visible redness can indicate inflammation in the deep veins. As a clot begins to form, it irritates the vessel walls, causing sensations that often worsen at night or when resting. If this discomfort appears repeatedly in the same spot, it's a sign your circulation may be compromised. 4. Unusual calf pain. Unlike typical muscle cramps after exercise, clot-related calf pain tends to appear without any clear reason. It feels deeper, like the muscle is being squeezed from within, and doesn't fade with massage or rest. If this pain is localized to one leg and lingers for hours or days, it could be the body's early alarm of a developing clot. 5. Skin discoloration. Have you noticed your foot or lower leg turning reddish, purplish, or bluish without any injury? This can signal reduced oxygen in the tissue due to restricted blood flow. Poor circulation also slows healing and increases bruising. When discoloration appears with other symptoms like cold feet, swelling, or pain, it's time to take action. The earlier poor circulation is addressed, the easier it is to restore and protect your vascular health. Pill the 4 essential vitamins for healthy circulation. 1. Vitamin D3, the vessel protector. Best known for bone health, vitamin D3 also keeps your blood vessels flexible and reduces inflammation inside the arteries. It even promotes the production of thrombomodulin, a natural protein that prevents excessive clotting. Studies from Harvard show seniors with optimal D3 levels have up to 30% lower clot risk. You can get D3 from gentle morning sun, fatty fish like salmon, egg yolks, fortified milk, and mushrooms. If you use supplements, always consult your doctor, especially if you're on blood thinners. 2. Vitamin C, the vessel builder. Vitamin C is crucial for producing collagen, the protein that strengthens blood vessel walls. It helps keep them elastic and resilient, reducing the chance of ruptures or inflammation. It's also easy to find. Oranges, kiwi, strawberries, bell peppers, kale, and broccoli are all excellent sources. Because it's sensitive to heat, try eating these foods raw or lightly steamed. For seniors, daily vitamin C not only supports immunity, it also keeps circulation strong and arteries youthful. 3. Vitamin B6, the blood regulator. Vitamin B6 helps control homocysteine, a compound that, when elevated, damages vessels and triggers clot formation. Together with vitamins B9, folate, and B12, it neutralizes these harmful molecules and protects your arteries. B6 also aids in forming hemoglobin, improving oxygen delivery to your muscles and extremities. Great sources include chicken, salmon, tuna, avocados, bananas, potatoes, and whole grains. Consistent intake helps blood flow smoothly and safely, keeping your legs energized. 4. Vitamin E, the circulation shield. Vitamin E is a powerful antioxidant that protects your blood vessels from aging and oxidative stress. It keeps vessel walls smooth and flexible, reducing the chance of platelets sticking together. A Johns Hopkins study found that vitamin E improved vascular elasticity in seniors within weeks. You can find it in almonds, sunflower seeds, olive oil, avocados, spinach, and broccoli. Because high doses can thin the blood, focus on food sources unless your doctor advises otherwise. Protecting your circulation naturally. Tingling, cramps, heaviness, or discoloration may seem minor, but they're often the body's early cry for help. Ignoring them can lead to serious conditions like pulmonary embolism, stroke, or heart failure. The good news? Nutrition and lifestyle changes can make all the difference. Vitamins D3, C, B6, and E work together to keep your blood flowing freely, dissolve small clots naturally, and reduce inflammation. Start simple. A morning smoothie with kale, kiwi, and olive oil. Swap processed snacks for almonds or avocado. Walk 20 minutes daily to activate your second heart, the calf muscles that pump blood upward. These small, consistent choices protect your legs, your heart, and your independence for years to come. Closing message. Healthy circulation means more than avoiding clots. It's about preserving energy, mobility, and joy in everyday life. Aging is inevitable, but losing vitality is not. With the right nutrients and habits, you can keep your blood flowing, your body strong, and your spirit young. If you found this helpful, don't forget to like, subscribe, and share it with someone who might need this advice. And tell us in the comments, how old are you and where are you watching from? Let's build a community of strong, healthy, and thriving seniors together.